So Baby's First Test is part of Expecting Health, which is a maternal and child health overview, you could say, from Genetic Alliance. And I put this here just to get a sense for you all, to get a sense of kind of the lens and perspective that I'll be speaking from. Our vision is that fear and confusion that individuals and families face during that prenatal all the way through those early childhood years is replaced by confidence and agency to make the best health care decisions for themselves, and their families. And there are some people who might say, going to sequencing is only going to add to the first part of that, more confusion, more fear. And it really is us to really make sure that we're building these systems, that it doesn't do that, that it focuses on really giving those families the confidence and agency that they need. So let's see if this will work. I wanted just to start off to actually hear from some families. These are some family reflections on the newborn screening program, but I think it can really help us think about what this will look like when we're thinking about sequencing.
So if you were to summarize somehow newborn screening in one word, what would it be? How would you sum it up?
For our family, it would be devastating. If I were to describe it for others because of the work that we do, I would say opportunity.
For my own personal journey, and I only speak for myself here, one word to describe newborn screening was unaware.
That's a tough question. Devastating, I would say hopeful. And a lot of work has gotten us to where we are, and there's a lot of work to go forward, but I do think it's hopeful.
I would say it's enlightening because for me, again, I took it for granted.
It's gonna sound cliche, but I would say a blessing.
For me, newborn screening is impactful. Without it, we'd be living a different journey.
Personal. What you know about it, what you do with it, how you move after it is all personal.
Great. Thanks for letting me share that. And to the folks in the back who have kept all the slides and now a movie with sound going. I know that's not always easy, but I really appreciate it. So Baby's First Test. Many of you know us as a website that has lots of information about newborn screening. But really what it is a concept and an implementation of a program to say, what does it look like to do large-scale education around a topic that most people don't know about, newborn screening, right? We are so lucky that we get to partner with all of the state programs, with so many researchers, with so many family advocates to get this information out there, and to also make sure that we're not just presenting the information that we think should be out there, but really hearing back from families and saying, well, what about this? And what about that? And being responsive. I think this is a really important model as we think about education when we're starting to look at sequencing as well. We also have a number of programs that support educational efforts for state programs, because as we know, many programs are very low resourced and have to focus on so many things. So we really help support those efforts. Again, I think it's great that through this meeting today and the time yesterday, we've heard the word collaboration when thinking about the programs we heard from who are focused on sequencing. I think there's a lot of ways to collaborate around education as well. I'll cut through this for time. So we've all been talking about this and are excited and talked about databases and information, and isn't it great, right? Well, what is the public hearing about when they hear the words newborns, genetics, and the future? I hate to say it, but it isn't quite as rosy. I know that these have come up in some of the talks, but I wanted to delve a little bit deeper. This is what the public, and we all know that's not just one thing, it's many different populations, but this is what's out there. And that's not because there hasn't been concerted effort. I want to make that very clear, not just because it's my work, but it's the work of the whole community. People are really trying. We talk about making sure that we are talking to families and have parent engagement. I would say Michigan and their newborn screening program was really, top of the line in that. They had a biotrust, they had a community advisory board. They still are dealing with lawsuits. So there's still quite a bit to be done in this space. And it isn't limited to newborn screening, right? Some of us, the first week of the new year, we were cleaning through our emails. Some of us were trying to respond to this big story down here around prenatal testing, and that basically from the headline, it's like, it's all wrong. All that testing you get, it's all wrong. That was the takeaway. This is a lot to combat. And I think that there could be quite the opportunity with all this excitement around sequencing for us to really think about, well, how do we, I don't want to say get ahead of the conversation because it's already here, but really meet it head on. Now, that's not to say that newborn screening programs are not responding, but you'll notice, and all of these articles are great, I know some of the authors are in the room, but you'll notice these are all in journals. They are not on the front page of the New York Times. And so really thinking about how can we be creative to really get our messages out, not just in amongst ourselves, but really where it's going to matter, and that is in the media and in front of all the different populations that, as we were just talking about, are trying to reach and engage and know that we're so very trustworthy. So what if we even go outside this vacuum of genetics, right? The conversation for families about how to keep themselves and their children healthy does not start with newborn screening. It's not going to start with sequencing. It starts beyond that. So what does that look like? Again, not so rosy. Just think about it, being someone who's expecting a child, and the stat you see is 84.2% of pregnancy-related deaths in the US could have been avoided with better care. Your starting off point is that this healthcare system does not really care about me. What here says trustworthy? And we may say, oh, that's pregnancy, that's different. We all know if you're actually going through it, it's one and the same. It's the healthcare system that you're engaging with. Again, I put this up here not to be a Debbie Downer or negative Natasha, but really just to say, this is where we're working from, and we have a lot that we can do. I think also in this space, I go back to maternal health. The past few years, there has been a real concerted effort to say, yeah, there are some real problems here, and we should be addressing it. Investments from our government partners, and I see one in the back. Thank you for all the work that you do, being able to address this, but also from companies and industry saying, we are going to look at this, and not just from a perspective of what's the data and what's the science, but really, what are these families' experiences and how do we meet them there, and how do they drive us forward? If you look at that maternity space now and all the companies coming up, it's really exciting, but it's really because it's finally meeting, saying, no, we're not going to do this. We're going to change the story, and we're going to do it as a collective. Again, I think something very similar may be starting here when we're thinking about sequencing and thinking about what does it look like for that newborn right from the start, getting the answers that they need and that their family needs and the support to go along with that. I typically use this slide for newborn screening, and I'm like, wow, it's the same for sequencing in terms of the things we're interested in and the things that we need to invest in. Yes, there's a lot of discussion about gene lists and conditions and what should be on and what should be off, and that's great, but we also need equal emphasis on the communication, how we're delivering results, how that's an ongoing conversation. It's not just a point in time. The number of times when I've spoken to families and they've said it was hard to get the diagnosis, but what was really hard was that it was a voicemail left on a Friday night. And then I spent the next 3 days, because Monday was a holiday, looking things up, not knowing how to look it up, not knowing even how to spell the condition, and then to get a response on a Tuesday. That we really need to be able to move beyond that. And that's not a story from 5 years ago or 6 years ago or 10 years ago. That's a story from last week. So again, how are we communicating these results? And again, I think it's been really great to see all the examples in the presentations that we saw today, but what does that look like at scale? Parent and provider education. So often people think of, oh, parents need this type of information and providers need that type of information, and it's completely different. I will say I think I've lost count, about 10 years of running Baby's First Test, I'm still so shocked that even though all of the information we put out is directed towards families, 50% of the usage is from primary care providers. They want the information in a way that they can then deliver it directly to their families. So let's look at that data. Let's not have it need to be oh so very sophisticated. Yes, some providers and specialists want that, but a lot of times people just need, what do I need to tell this family now? I also want to point out, and a lot of times people say education is really hard and it's hard to scale. It does work if you know what you're looking for and if you know how you're identifying what success looks like. I think a lot of times we use awareness building efforts like social media and then try to measure it in terms of like an actually in-depth training. Those are different things. Someone having a general sense that a baby gets some screening for some conditions is different than them being able to rattle off different definitions. All are possible, but I really encourage you when you're thinking about the educational component of your work, what is it you're actually trying to achieve? And are you making sure those measures match your strategies? This is just some work from a program that we're doing that is an in-depth educational initiative. So we work in prenatal settings. We give parents a QR code. We say, we know you're going to be sitting here for the next hour. Look at this booklet. We do pre and post test. Again, very in-depth, but we found a time when they weren't really doing anything else, and we could really see that there was quite a change. And even here, the font's very small. I'll see if I can read it. To us, it wasn't just important that they knew a definition. We wanted to know, do you trust this information, right? We went back to trustworthiness. Do you feel like you can actually talk to your doctor about the information? Do you want to have that conversation? Do you have enough information? And do you know where to look for more information? Again, doing this, I think this is something that I really encourage when we're looking at education and as different groups are doing a lot of different work around sequencing, to ask those types of questions. To me, those are actually engagement questions. Can you go and talk to your healthcare provider? That's really different than saying, oh yeah, I can pick a multiple choice and pick the right one. And again, if engagement is what we're looking for, that's the type of thing that we should be measuring in this way. So as I close up, what can we learn from what's already been done? I think there's so much new happening, but I think we've also heard, a lot of the same questions, a lot of the same challenges. When you're thinking about education, it is not one and done. I think what we saw, even like I said in the example with Michigan, for years, they have been really working with their communities, and there still is some distrust by some people. And it doesn't take many, right? So really thinking about what is going to be the long-term process. It's not just about what do parents think today, but what are they going to think in 5 years when maybe we feel like we're being super successful? Is there something going on? Is there an undercurrent that we may not know? Educating families without educating providers can lead to quite a bit of tension. I'm really lucky to get to work with a lot of family leaders, and I will say one thing they often say is, I've read the books, I've gone to the trainings, I know how I'm supposed to speak with providers, but they don't seem to know how to interact with me. They're just giving me some information and they're not wanting to have a conversation. This isn't partnership. So how do we make sure we're training on that side of things too? I've heard a lot that individuals are altruistic, and though I do believe that, again, I'm not a negative Natasha, I swear, we can't rely on that altruism to make sure that systems are equitable. Because even though, yes, people really care about people who are like them, that definition of like them may be a lot more narrow than sometimes we want to admit. So I think really thinking about those different ways of approaching equity, and then also those real in-depth forms of engagement. Really hearing, and I can't remember which group it was, but really seeing how throughout the process of their program, there's patient engagement, and I encourage really having engagement from people who might represent other populations, not just the rare disease, but if you're going to be reaching out to everyone, really getting representation from that as well. And to lead right into that, the public is not just one thing, even though I know I say it too, the public. We really need to see who are we talking about, and how are we going to be multifaceted enough and invest in that multifacetedness to make sure that we are hearing from the yeses and the nos and the, I don't know, I need to hear more, and doing that on a long-term scale. And lastly, the idea that it's for the babies, that message just isn't enough in today's world. Everyone's trying to do something that is generally good for people, right? Like everyone can get on board with that, but we need to make sure we have our messaging in terms of thinking beyond just for the babies, but for the families. And this is what we're learning, and this is what we're going to find out. And that's how we're going to infuse those learnings back into this work so that it can have an impact on communities and on those individual families. Thank you.